Hello, Nita Valens. How are you today?
Doing great. And yourself?
I'm living it up.
Yay. We love that phrase. And we want all of our listeners to be living it up too. But we are dealing today with musculoskeletal system pain. And we'd like for you to call and see if Dr. Darrow can help you strategize how to get out of that pain, which includes joint pain, ligament pain, muscle pain, tendon pain, arthritis pain, neck pain, back pain, hip pain, knee pain, toe pain, headaches, neck pain. So do give us a call. Our hour goes quickly. So 866-870-5752 is our number for you to call and talk to the doctor about your pain. And when you phone the show today, you get Dr. Darrow's latest book called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. It's all about stem cells and platelet-rich plasma. And check out the website where you can see Dr. Darrow perform the treatments on video at www.lastemcells.com. That's lastemcells.com. And you can also email him off of every page on the site. We are here Saturdays at 10 a.m. and 1 p.m. And again, our number is 866-870-5752. Give us a call and don't delay because the hour goes quickly, doesn't it, Dr. Darrow?
Well, the problem is we get our callers at the end of the show often, and we implore you to please, is that a good word?
Yes.
To please call now, and then we can talk to you. Otherwise, we get a full board by the end of the show, and then the show is over. And then you just have to email me through the website instead of talking to me. And it's a lot clearer information to be able to speak together. If you want to go to the website, you can get a hold of me. Through every page, there is a spot to email me. And that website is www.lastemcells.com. lastemcells.com. And I'm glad to hear from you. I get back to everybody, usually the same day, and we can start a dialogue on that. But it'd be great if you're listening now to just pick up the phone and give us a buzz at 866-870-5752, 866-870-5752. And I'm going to give you another phone number to call in if you want to get a hold of me at my office, or if you're interested to see if we take your insurance. If you call, even now, we can get you a verification to see what is covered. And that phone number to the office is 800-300-9300, 800-300-9300. And you can find out more than we talk about on the show by calling in, or if you want to get an appointment, you can call in to the office number. We do take many insurances. We take Medicare and Cigna, Aetna, Blue Cross Blue Shield, United Healthcare. But just because you have that doesn't mean we take the one that you have, because insurance is complex. Don't ask me on the show if I take your insurance. It's got to be verified. And we do take, for people that have no insurance, something called Care Credit. That's a credit card that we can help you get, and there's no interest for the first year, so that's a pretty good deal for you.
Sounds terrific. If you're tuning in late and just joining us, this is Living Pain-Free with Dr. Marc Darrow, and we would love to take your call at 866-870-5752. That's 866-870-5752. And this is all about pain that you may having in your joints, your back, your neck, your knees, ankles, toes, muscles, ligaments, tendons, arthritis pain. So give us a call, 866-870-5752, and I bet you have
many
emails.
I know what you're thinking. I have endless questions sitting here on my computer that I'm looking at right now to get the show going until you guys decide to call in. The first one is labeled meniscus. And as most people know, the meniscus is a cushion in between the joint, the bones of the knee. The meniscus is fibrocartilage, and it is a cushion. So when you're jumping up and down, it is impacting that meniscus. And this person says, they come from a 413 area code. I wonder where that is. I had sports-related injury to my left knee in May 2014, quite a while ago. And then in parentheses, this guy says, a tear in my medial meniscus. So before we get any further, I want to say that the doctors do not know that the injury caused that meniscus tear. When we do studies on people that have no pain and have never been injured, guess what we often find in the knee? Any guess, Nita?
Well, we find that there's
yes,
cartilage.
You're right.
There's
meniscal
cartilage.
Tears. Meniscal tears.
But that doesn't mean that if there's meniscal tears, there's necessarily pain, though, right?
That's right. So we can't put this chronologically with an injury. So what happens, the confusion is someone tweaks their knee or some other part of the body, and they'll find some kind of anatomical deficiency like a meniscus tear or a meniscus tear. And then they go to an orthopedist who says, whoa, you got a meniscus tear from this injury. That's what's causing your pain, and we're going to cut it out. So let's go back to this email. The person then says, I had part of my medial meniscus surgically removed. Was that necessary? Not in my book. I have meniscal tear in my knee. I'm not cutting it out. What did I do? I injected it with stem cells. I'm all better. You can see the golf hat. Yes, I'm wearing it. I'm on a video, Anita.
I love it.
It's a golf hat, and that's where I'm going after the show.
Golfing.
Yeah, and I'll probably go take a run today. I do a lot of stuff with that knee, and it's doing well. Yeah, I have a meniscal tear. So what? Then the person says, can collagen be used to help build the meniscus? Well, what we actually do is we inject that area with cells from your body. It can be your platelets. It can be your stem cells. We could use cord blood stem cells that are purchased. There's a lot of controversy about that latter treatment, which I'll get into at some point. But anyway, at any rate, the pain does go away. People get better. I'm one of them. I've used this stuff all over my body going back over 20 years. My first injury is my wrist, and I couldn't use it for sports. I injured it by hitting the ground with a golf club. I didn't hit the ball. I chunked it. I hit the ground. Hyperextended my wrist, and I injected it. One time, actually someone else did it the first time, and I was about 50% better within 24 hours. I then injected my own wrist a few times. This wrist is doing great. I use it for all my sports. It's my right wrist, and I'm not having any problems with that. I don't remember any pain in it for many, many years. And I've used these techniques of regenerative medicine using platelets and stem cells. Back in the old day, we had prolotherapy, which I used. But since then, I've done platelets. I've done stem cells on my shoulders and my knees with great success. And it's been working for my patients for a long time. And I would say stay away from knives. You don't want to cut tissue out. All right, let's see what this person then goes on to say. Can collagen be used to help build the meniscus? Yes, but we do it by growing the collagen. I might be wrong, but believe that treating my knee with stem cells as well as regenerating my lost meniscus would add years to my knee, thus delaying a total knee replacement. Well, we don't delay a knee replacement. We get rid of the concept. There's no reason to do these surgeries unless, if you've got a knee that's smashed and there's nothing left, you're going to have to get an amputation of the bones and then put a prosthesis in there. But that's rare that people need to do that. I have people come in the office almost every single day saying they've been told they need a knee replacement. I move their knee around. It's a great knee. And they go, what do you mean it's a great knee? I tell them, this is a great knee. Well, you don't need a knee replacement because a doctor tells you you do. It's an elective procedure in most cases. Who gets to elect? You do. And if you want it, God bless you. Go do it. But I see terrible results from it. I had one patient who died from it, from a blood clot, and many patients who've had infections, who have had nerve injuries, you name it. Sometimes one leg gets longer than the other. It doesn't fit right. It's not something I'm ever going to tell a patient to do unless that knee is so far gone. But most knees that I see are not, and they're still told they need a knee replacement. Person then says, I look forward to any insights or suggestion you may wish to offer. Sincerely, I won't say their name. So yeah, I mean, I've been regenerating tissue in the body for sports injuries, arthritis, all over the body from head to toe for over 20 years. I've been doing it on my body for that long. And I do injure myself. That's true. Things happen. And when you're active, things happen more often. I'm pretty active. And I'm 70 years old, and I don't plan on really being older than 16. I don't care what they say on my birth certificate. I'm going to stay 16 until the day that I die. I'm going to do sports. I'm going to be moving around. I'm going to be active. And you can too. 16 is the time that I would, if I were you, clock in to who you are. Stay skinny. That's another way to help do it. Speaking of which, why don't you give us a call at 866-870-5752 and let us hear your story. And by the way, area code 413 is Western Massachusetts. So that's good. We got people looking at us. We do have people actually coming not only from all over the country, but I have people that come from all over the world to get these treatments. And it's hysterical when someone calls in from Manhattan Beach and says, well, that's too far.
Well, this guy might fly in from Massachusetts, or gal. So, I mean, it's a relative thing, isn't it?
It's all relative.
You have to be
willing. If you want to get fixed and you want to get rid of the idea of cutting your body and having terrible results, I would consider coming to the office. We're in West LA. We're across the freeway, the 405 from UCLA on Wilshire Boulevard. Easy to get to, and it's no excuse. My average patient drives about 2 hours to see me.
Well, here's the thing. If you want to be out of pain and improve the quality of your life, you have to be willing to do anything. And driving a little, flying out, get a hotel, stay with friends, relatives, there's a way to do this if you really want to. 866-870-5752, 866-870-5752. But at least call and let Dr. Darrow tell you what might be possible for you in the realm of healing in a more natural way as opposed to rolling yourself into an elective surgery. I mean, it's worth the conversation, don't you think?
Well, it certainly is. I can tell you in about 2 minutes whether I can help you or not. Should we go another question?
Sure.
Hip, hip, hooray.
I like it.
So this one says hip. I am a 23-year-old male who has had hip pain for about 6 years. Whoa, since he's 17. Just got an x-ray at my school and saw that I have DJD in my left hip. Degenerative joint disease. Okay? Now, when a doctor sees that, they think about what, Nita?
Well, probably
surgery.
Right. They think about surgery, but this guy's pretty young for that, isn't he?
Everybody's pretty young for it. That's the point of the show. The show is, the byline is taking the surgery out of pain.
That's
right. We don't get surgeries because we have pain. We regenerate. He then says, I'm interested in learning more about this procedure. He's talking about stem cells, as well as when you get the initial stem cell, or where do you get the stem cells from? Please give me a call at this number if you have the time. So I will do that. Where do we get them from? For thousands and thousands of people, I've been taking them from the pelvis in the back at a place called the PSIS, which is the posterior superior iliac spine. It's right above the buttocks. It's a spot that we can put a needle into very simply, and then we can aspirate out bone marrow, and we can then inject it. The newer thing now is using cord blood stem cells. And there's a big controversy in the medical community about whether they are alive or dead. Now, I am what's called an empiricist. I am not a scientist. And they can argue all they want because doctors actually and scientists argue about what a stem cell actually is. There are certain markers on cells that show what they are. Under flow cytometry, the company that I use for cord blood has indicated, and I've seen this, that these cells are alive. I'm not going to argue with anyone about alive or dead, but you do need to know that they may be dead. Do I care or should you care? The answer is no, and I'm going to tell you why. We have a study going on with hundreds of people who have had bone marrow stem cells versus cord blood. And guess what the results show? Nita, you got a guess?
Yeah, that the results are just as good as pulling from the person's body the PRP or stem cells.
Well, you're right. So why get drilled into the pelvis if we can just take this out of our freezer? They're kept at 80 degrees below zero. And just mix them with PRP. PRP is platelet-rich plasma. It's a process of just drawing blood from your arm, and just like when you get your labs drawn by your doctor. And we just mix in the cord blood stem cells with it. It's a very simple procedure. And I've got to be honest, since I've been purchasing these cells for people, nobody wants to do the bone marrow. Why do you think that is, Nita?
Well, it's painful to do. Who wants pain?
It's not really painful, to be honest. I mean, I haven't had it done to me. I can't reach around there to do it to myself. I do PRP on myself, and I use the cord blood on myself with great results. But people find it uncomfortable. It's a better term. We do just numb up the area if that's what you want. I do occasionally. I get maybe 4 people a week who want their bone marrow used, and I do that very easily. It literally takes about 15 seconds to do the procedure once I've numbed up the area with some lidocaine. But most people, when I give them the option, I give everybody the option of what they want, whether it be just PRP alone, whether it's PRP with cord blood stem cells. And by the way, the cord blood has more than just stem cells, so even if they were dead, there are many things like exosomes and cytokines that are healing factors and growth factors that can stimulate tissue to grow. But we're finding now people just don't want the bone marrow. Now, when it comes to fat, there's a lot of doctors who do fat stem cells. I find that abdominal and abominable at the same time, because that's kind of a nasty procedure. I started using those first, and I'm trained how to do them. I don't like doing them. We have to make an incision. We usually use the belly where the most fat is, but some people are skinny, and we have to go into the buttocks or other places. The real problem by using what we call adipose or fat is that it's very dense, and we're not allowed to manipulate the fat. That's called minimal manipulation in what we can do. And when we do that, we have to beat it up with a trocar. It's about a foot long, dig it in there, and then we need to use a big fat needle, an 18-gauge needle, to inject it with. Now, when I inject a shoulder, I'm going to inject all of the tendons, I'm going to inject all of the joints, and I'm going to inject the subdeltoid bursa. And that's a lot of pokes. You don't want to do that with a big fat needle because it's going to end up looking like hamburger meat. And if you're going to a doctor who's injecting your shoulder one time with stem cells, I promise you it's not going to be great results. It just can't be. There's too many areas to inject.
Well, if you'd like to know how this all applies to your particular pain issue, do give us a call at 866-870-5752, 866-870-5752. And remember, you will get your free book today when you call. That is lots of research on stem cell and platelet therapy. And also, the website is www.lastemcells.com. That's lastemcells.com. And we're here Saturdays at 10 and again at 1 p.m. So lots of great information today you're talking about. This, I feel like I'm in class. This is very exciting, actually.
Well, it's always a class, and that's why we like the calls.
That's right.
We all like to learn. May I go on?
Of course.
Okay. I'm going to just mention the diet we use in the office, which is called Ideal Protein. If you're overweight, I'm going to ask you to lose weight. You can do it yourself by just dropping out your carbs, getting off of grain and dairy and fruit, except for berries. They're low glycemic. Obviously, alcohol is sugar. We want to get you off of that. And sweets, of course. Once you drop your carbs, you start eating your own fat, and you'll drop your weight very quickly. We also have a diet called Ideal Protein, where we do the work for you, and it's all prepackaged stuff. So I did it for 1 week. I lost 7 pounds, and if you can see me on this video, I'm pretty skinny to start with. I did it for an experiment. So everybody loses weight on that. The other thing is my wife, the beautiful Michelle, is a nurse practitioner and does what I do on faces. She does the vampire facelift, and it's taking your platelets or stem cells and injecting them in the face to regrow the collagen and make you look young. Everybody likes that. Yes. We get just as many men as women who come in for those cosmetic procedures. So this email says the elbow tear surgery at the lateral epicondylitis, that's an area right at the outside of the elbow, 16 months ago, and still sore. I had cortisone. Well, what does that do? That makes it worse. Cortisone is a steroid. Cortisone is O-N-E at the end, like prednisone. And what does it do? It eats up the tissue. I had a woman come in years ago who had 16 cortisone shots on her elbow. She wasn't able to lift up her wrist anymore. It took quite a bit of regenerative medicine to regrow that tendon. It's a very thin tendon, and get her back to playing tennis again, which we were able to do. So stay away from the cortisone, stay away from the surgery. Just start out regenerating it. We can use your cells, we can use PRP, we can use stem cells, and get rid of the pain and heal the tissue that way and grow it back. Then he says, and my left elbow now sore, no surgery, thank goodness. Partial tears. Is PRP or stem cell better? And then he goes on to a problem with his neck, but I'm going to hold off on that for a second. The tears don't seem to be an issue. I've seen them actually heal when we do MRIs before and after. And there's a very good friend of mine now who came in with a tear on his left elbow. He's probably one of the most famous musicians in the music world of law. He's a lawyer, but a musician too. And I'm going to ask him if I can give out his name sometime. I won't now because I haven't asked. And we did an MRI before and after, and that tear in his left elbow completely healed. He was able to go back to playing guitar again, and he's an avid tennis player. He loves sports. And there we go, Nita. It's break time.
It is break time here on Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we want your calls as soon as we come out of our little break at 866-870-5752. We'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.